Now, the virus that leads to polio has been detected in London in a number of sewages across the city. Polio was eradicated in the UK back in 2003, but the UK Health Security Agency announced this week that it was possibly imported by someone who'd recently been vaccinated overseas, where a live form of polio was detected. Experts say that the risk is low, but we have invited a doctor onto the programme today to lay out all the facts for us. So welcome, Dr. Emeka. Thank you very much indeed for joining us.
No problem.
As we say, polio has been eradicated in this country since 2002. I think, as I understand it, it's been found in one specific area northeast of London.
Yes.
How worried should we be about this, though?
I wouldn't say too worried at the moment. So they actually haven't found any cases. What they have found is detected samples in sewage in northeast London, which they believe has been brought by somebody who's travelled overseas who had the live vaccine. So the way we get vaccinated in this country is we have the injectable dead version of the vaccine. However, they have the oral live vaccine in other parts of the country. So it could have been brought over. We actually haven't seen any cases. However, we do know that it affects a lot of children under the age of 5. So my colleagues and myself in A&E are then obviously keeping ourselves aware of children coming in with viral symptoms who may potentially have been affected by the polio virus.
Well, what are the symptoms?
So the symptoms are general viral symptoms, so fever, malaise, headache, fatigue, lethargy. And then
which could be actually mistaken for other things.
It could be mistaken for almost any virus.
Yeah.
Obviously, we know now with COVID virus, we know with monkeypox virus, any viral symptoms are similar to that. However, when it gets into the CNS, the central nervous system, this is when it gets quite serious, because then it could cause what we call paralytic polio, which affects children, and that's when it gets very, very serious.
Yeah.
So that's something we're obviously looking out for in terms of detectable, because during the COVID times, especially children under 5, a lot of them haven't actually received the full vaccination.
Yes. I mean, I think the figures are, 100,000 children under 5 have not been fully vaccinated.
Yeah, we're urging parents to make sure they're checking their red books and making sure they're getting their children fully vaccinated if possible, because you should have at least 5 polio jabs in early childhood by the time you get to your teens. And that's one of the reasons we've seen the eradication here, because of our great vaccination program in the NHS. So it's really imperative that parents are making sure that children actually adhere to it.
And how will they do that? Because, I mean, a lot of them didn't get it because they weren't at school.
Exactly. So they should be contacting their GPs in the community to make sure that they're up to date with their jabs.
And they will have all their medical records.
Yes, they will have all their medical records, and they can get their boosters if they need to.
Good. Now, I'm of a generation that actually remembers polio before it was eradicated. I can remember as a little girl seeing, children come to school with calipers on their legs to, to keep them straight. I knew of families where a member of the family contracted polio to such an extent that they had to be put in what we call an iron lung. And as I understand it, there is still one man in Texas in America who has been in an iron lung since he was 7 years old, and he's now coming up to his 70s. But, we don't have that anymore. But do you think that perhaps we become complacent? Just remind us of how dangerous polio is.
It's a terrible virus, and myself, being Nigerian, I've come from a country where it's been endemic before, and we've suffered a lot with polio. You know, it's there in Pakistan and Afghanistan, and we believe that's how it may have come over. So what we're doing is we're encouraging everyone to make sure that our hygiene and hand washing is really, really at the forefront.
Something that you talk about in your book.
Yeah, something I talk about in my book.
In your hands. But I mean, I'll come to that in a second. But just, I mean, have we become complacent, do you think? I mean, how deadly can it be in a population?
We have to remember that diseases, they don't respect borders. Yeah. So, obviously with travel and tourism now, disease can be brought in and taken out of any kind of country and brought from across the world. This is why we need to make sure that we're very fortunate in the NHS where we have a system where our hospitals are clean, we have clean running water. A lot of these countries where polio is endemic, such as Nigeria and in Asia, Afghanistan, Pakistan, a lot of the urgent care centres don't actually have clean running water, and so they can't practice hygiene at an efficient level to eradicate polio. That's why one of the reasons I've actually worked with Water Aid ahead of the G7 summit is to actually, urge the governments and the powers that be to kind of provide these countries with systems where they have cleanliness and clean hygiene, and then eradicate it in their own countries before kind of bringing it over here. I think that's really, really important.
So is the polio virus something that can be eradicated just by having a healthy form of living?
It's a fecal oral virus. It's an enterovirus. So if you keep your hands in your mouth very clean and you're washing regularly, you're way less likely to cause spread. You're more likely to limit spread that way. And then obviously if you're vaccinated on top of that, you'll have nothing to worry about. Yeah. So between vaccination and obviously clean hygiene, just like how we've managed to vaccinate ourselves with COVID and obviously masks and space and washing our hands and gelling our hands, and we've seen obviously the reduction in the number of cases and mortality with COVID. It's the same as polio, and that's how we were able to eradicate it the first time. And if we continue, then obviously we shouldn't have many problems.
No, I mean, we've said we eradicated in this country back in 2003. But, I mean, you've touched on it already, the fact that we're all able to move around the world in the way that we can.
One of the things,
there are many places in the world where polio is still endemic.
Exactly. And you're not always symptomatic with polio, so you could be carrying and spreading the virus without even knowing it, just by going from country to country. That's why it's really important, whenever you go into the toilet, whenever you're eating, you are making sure that you're washing your hands thoroughly every time. As in, for me, it's kind of second nature with my job. I'm just used to it all the time, gelling and washing my hands. But a lot of people aren't.
No.
A lot of people work in sectors and jobs where their hygiene isn't at the forefront and they're not used to it. And they're used to going to the toilet, maybe not washing their hands, maybe having a sandwich.
Well,
I know it sounds gross,
I cringe
but
when I go into a public toilet and I see somebody walk out who hasn't washed their hands. But I mean, you cover all of this in your book because you feel very strongly about this,
100%.
don't you? It's your health in your hands.
You're very right.
And even where polio is concerned, it's still in our hands to try and eradicate it.
So many conditions and diseases we have today, we can actually do something about at the forefront, at home. And that's what this book is about. It's basically a little Bible, if you will, a little like booklet on how you can future-proof your health by doing many simple little changes which can eventually help you, one, acutely at the forefront, like now, in terms of virus, and then loads along the line of chronic disease down the line. So that's why I'm encouraging people to read it, because a lot of people are actually like, oh, I didn't actually know this. I didn't know I could do that for my own health. And you'd be surprised how many patients I see coming into A&E who, if they had this kind of knowledge back in the day, probably wouldn't be seeing me to this day. And they're like, oh, doc, I wish I knew now what I did when I was a kid. And I'm like, yeah, it's not too late. You can still take your health into your hands.
We can take responsibility for our health ourselves.
Responsibility is important.
Doctor, thank you very much indeed for coming in and joining us. And I hope that what you've done is given a lot of parents, taken a lot of the stress and the anxiety away from a lot of parents who may have been worried by those headlines.
Just to be vigilant, make sure their children are vaccinated and make sure their children are washing their hands.
Thank you very much indeed. Good advice there from Dr. Emeka. Oh, I'm not even going to try and pronounce your surname. What is it, Dr. Emeka?
Okorocha.
Okorocha. Thank you very much indeed. And he's the author of that new book, Your Health in Your Hands.